Okay, this is the third part of the video. I'm finishing it on my phone. I have run out of space on my camcorder now. I have just palpated or percussed the liver, and I'm going to attempt to palpate. I'm going to have to work kind of quick because I don't know how much memory is on my phone. I'm going to take a big deep breath in and out. Big deep breath in. Big deep breath in. I'm not able to palpate the liver, and I'm going to attempt to palpate the spleen, which isn't very common to be able to palpate. I'm not able to feel the spleen either. I'm also going to go ahead and palpate the quadrants of the stomach. Any pain or tenderness?
No.
Okay, and I'm going to next elicit your abdominal reflexes. Shouldn't really have an abdominal reflex. Excuse me. Okay, go ahead and sit up. I'm going to assess for kidney tenderness. Any pain?
No.
Okay. The musculoskeletal system is next. Her body is very aligned. She has great posture. There's no abnormal curvature of the spine. She had an equal stride when she walked in. I observed her skin folds and the tissue when she did not have her shirt on. She really didn't have a whole lot of skin folds, just in the abdominal area. Everything is clean and dry. There is no rashes, no yeast, no abnormal smells. Very hygienic. Hey, those yeasty beasties have that smell.
Mm-hmm.
Muscle contraction, or inspect muscles and compare contralateral size. She's not a very muscular person, but she does work out. We are working on getting that muscle tone. You don't have any tenderness in any of the muscles. I know you've been working out a lot. We're going to test abduction of the thumb. Hold your hand out like this. Now push your thumb up. Okay, now put it up. I'm going to try to push it out. Okay, assess your joints. And do this one. Push your thumb up. Okay, and then you put it. Now push. Okay. She doesn't have any joint stiffness noted. She has a wrist flexion of 90 degrees, and can you hyperextend your wrist? Both? Okay. Go ahead and squeeze my fingers for me. She has equal hand grips. I'm going to assess your elbows. Flex and extend. I have it kind of a little bit fast. So now I'm going to go on to all the tests. And what we're going to start with first is the Hawkins test. And this is associated with rotator cuff repair, which she has had both rotator cuffs repaired. When was the last one? In 2010. So what I'm going to have you do is, this is a Hawkins test. I'm going to have you hold your arm out here like this, and I'm going to force your hand like that. External. Do you have an increase in shoulder pain?
No.
Okay. Increase in shoulder pain?
No.
Okay. So that's a negative. Next is the Meir test. I'm going to lift your arm up, and I'm going to depress the scapula. greater tuberosity and the supraspinous muscle against the anterior and inferior acromion. Is there any pain?
No.
You couldn't even lift your arm up like that when she had the rotator cuff tear. It's still recording, yeah. We already did the thumb abduction test. The Tinel sign assessed for carpal tunnel. So we're gonna go like this, and I'm gonna strike my finger right here in your tendon. If you have carpal tunnel, it'll tingle and you'll feel like a burning pain.
No.
A little. Might have a little bit of carpal tunnel going on.
A little tingle.
Okay, next is the Fallon test. So we're gonna hold both of your wrists in a fully palmar flex position with your dorsal surfaces pressed together for 1 minute. So we're actually gonna have to do it for about 30 seconds just because I don't have about that much space on my phone. So you're actually gonna go like this, and you're gonna push together. If you experience any pain, let me know. Okay, I'm gonna go ahead and have you stop. No pain?
No.
Okay. We're now gonna test allotment. So I'm gonna have you move your glasses. Go ahead and lay back for me. I'm gonna put your feet up. So allotment tests fluid in the knees. So I don't know how I'm gonna do this with your pants on. I'm not gonna take your pants off, but so your knees extended. Bend it just a little bit, like barely. So with this one, you like milk fluid forward. And there's supposed to be if there is fluid, it would build up in this area because you're bringing it all forward. And that would be the allotment of the patella. The bulge sign is really similar to allotment. You extend the knee and milk the medial aspect of the knee upward 2 or 3 times, and then milk the lateral side of the patella, and then you go ahead and straighten it out. So kind of go like this. Actually. And then you milk it, and then you push on the side, and then if there is fluid goes from one side or the other. So like if I pushed on this side, fluid would come out over here, or if I pushed on this side, fluid would come out over here. That's a positive bulge sign because the fluid like bulges out. The drawer test, this identifies instability of the anterior and posterior cruciate ligaments. So I have you lie flat, and I'm going to flex your knee 45 to 90 degrees. And I'm going to put your foot flat on the table. Place both hands on the lower leg with the thumbs on the ridge of the anterior tibia. And then you pull. And it's supposed to elicit pain or separation. And then after you pull forward, you push backwards as well. Is there any pain when I do that?
No.
The Lockman test, go ahead and put your leg flat and then kind of bend your knee outward, like turn your, just like that. Okay, I'm gonna put one hand above your knee like this, and then stabilize like this, and I'm gonna pull. Is there any pain?
Not really.
The McMurray test detects a torn meniscus. So go ahead and put this knee up. So. Any pain?
No.
And this is testing for a torn meniscus, and I would hear an audible click, and I don't hear anything. The varus and valgus test. So, with this one, I lift up the leg and hold down like this, and you don't rotate your hip. You exteriorly rotate, and then the other one you interiorly rotate. In any pain, so she has tights on, I can't actually see the leg, but there is no pain elicited with either one of those tests. Now the straight leg test, you just lift your leg up higher. Okay, go ahead and put it down. Go ahead and raise the other one. Any pain?
Nope.
If there was pain, it could indicate injuries in the spine. Now the femoral stretch test, I'm actually gonna, is this gonna slam you back if I lay it? You actually have to lay on your stomach. Okay. So I'm gonna raise this foot up. Let's see which position. And I'm gonna lift up, okay? Is there any pain?
No.
Okay. That's a negative sign that if there was pain when I did that, then that would be a positive sign. Okay. Stand up or sit up. So, and now we're going to do the Trendelenburg test, which you might want to take your shoes off. We're going to stand up. And that's when you're going to stand, can't even stand, on one hip with one leg up, and then you're going to switch. And I'm going to lift your shirt up so I can see your iliac crest. I'm going to observe the iliac crest for any disproportionate angles. What she's almost even like that. Go ahead and switch legs. Okay, there's no angle when she does that. Her hips stay equal. She has rapid and rhythmic movements. She has, they're smooth. She's able to move fully with no problems. She also, we're going to do the finger to finger test. So, finger to nose. Let's see. Let's do a heel toe walk. Okay. She's able to walk without any swaying or deviation. Now we're going to do the Romberg test. Stand there with your eyes closed, please. Feet together and arms at side.
Up.
Side.
Up.
She may sway just a little bit. If she was to fall over, that would be a negative test, or she would fail that test. Okay, she recovers her balance. I'm supposed to throw her off her balance to see if she can recover. The third test for balance, I'm going to have you stand on one foot with your eyes closed. Your arms either side, yeah, take them off. Nope, you gotta stay up for 5 seconds. Okay, the other side. Okay, now I want you to hop on one foot and then switch to the other for 5 seconds. Okay, switch to the other one. Okay, and I have already observed her gait. She has excellent posture. She has an equal rhythm. Her stride is even. She sways her arms slightly at the side when she walks. I need to test for, go ahead and sit down. Excuse me, I apologize. Sensory function. So, close your eyes for me, and I want you to tell me where I'm touching you.
My arm, you touched me with a tissue. My face, my neck, my hand.
I was touching your knee, but you have
Oh.
pants on. I'm going to test your vibratory sensations with a tuning fork over a couple different bony prominences. And you just tell me whether or not you can feel this or not, if you have a buzzing or tingling sensation.
Elbow, knee, vibration.
You
Yeah.
feel it? Okay.
Yes.
Okay, close your eyes and I want you to tell me what I'm doing.
You play with my thumb,
What am I doing?
moving it up and down.
Okay. Now I'm going to put some stuff in your hands and I want you to tell me what it is.
Glasses. Stethoscope. L.
Okay. Good job. Okay. Now I want you to tell me where I'm touching you at. I don't have 2 sterile needles to do this. Do you want me to poke you with needles?
No.
Because there's 2 needles over there.
Mm-mm.
I'm going to do 2-point discrimination, okay? Close your eyes. Tell me where I'm touching you at.
Shoulders. Elbow and knee.
Okay. I'm going to, let me see your hand. I'm going to, get
Am I
it.
supposed to be looking?
No. Tell me what letter I'm writing.
A.
What number?
2. 1.
Okay. Okay. We're going to do reflexes really quick. Test the biceps. This should elicit elbow flexion. Okay. Okay. I'm not seeing forearm pronation. Supposed to elicit forearm pronation. I'm gonna have to just do one side. So we're gonna do the tricep. This should produce elbow extension. Maybe I'm not doing it. Patellar reflex.
That
And the
word.
Achilles reflex. Okay. I'm gonna test for ankle quantus, so go ahead and lay back. You move this so you don't know it. So this, I'm feeling for any rapid, so totally relax for me. I'm gonna hold your. Okay, I'm not feeling any like rapid movements of the muscles, no shaking bicep. Okay, one more test on your feet. Plantar reflex. Yep, that was a good one. And actually that concludes the test. Thank you.